Hi and welcome to 10 Minute Medicine. My name is Travis, I'm an ST1 in intensive care, and today I'm going to take you through the Horus e-portfolio, something that you'll have to fill out through both your F1 and F2 years. It's something that can be considered a bit of a pain, but actually if you keep on top of it, it's quite easy and it gets you into the habit of keeping a portfolio of your achievements. This is the page that you'll be greeted with as soon as you manage to log in, hopefully with nothing to sign and nothing waiting to be signed. Usually, however, this will be full of forms that you're chasing either registrars or consultants to sign for you. Across the top, you've got your links back here, as well as to your portfolio overview, which we'll come back to later, and finally, all the forms that you'll need to get completed. Usefully, it breaks them down to the beginning, middle, and end. At the beginning of every placement, you need to have a meeting with both your clinical and educational supervisor. Usually, at the beginning of the year, this will be the same person. But as you move through, your clinical supervisor will be specific to the job that you're currently doing, whereas your educational supervisor stays the same throughout the year to offer you stability. It's worth noting that you can't start any of these forms, and if you click onto them, it will tell you that your supervisor needs to start it. So it's worth checking that they have done. During each placement, you have to complete mini-KEXs, DOPs and CBDs. These are all work-based placed assessments and we'll break each of them down. However, it's worth noting that you need to do 3 mini-KEXs, 2 CBDs, a minimum of at least 2 DOPs is ideal, although it's not required necessarily, and normally at least 2 reflections. Usually I like to lay these out so you do one on the overall placement and what you learn, and then you can do one on a specific encounter that you've had or something that you think you'd really like to reflect on. Finally, at the end of each placement, you'll have another meeting with your clinical supervisor and another meeting with your educational supervisor. A placement supervision group, just to note, is if your clinical or educational supervisor has set up a group of people that could also give you feedback. For example, if they're not in the hospital that much, and this is where they can give you feedback as a group. This is quite uncommon to see. So if we click on to mini-KEX, you'll be taken to the placement you want to do it for, and then the overall generic form where it's just got all your details at the top, and then we'll go through this structure, which you'll see with all the forms is the same. You put in the date, the title, and a brief anonymous description. You say how it applies and the problems that it's focused on, as well as what you wanted to get out of it. And at the bottom here, the trainer will give you feedback. You will reflect on it, and together you'll come to some agreed actions that you're going to complete as a result of this. And ideally you'd get all of these filled out and then pop the trainer in the bottom. It's worth noting that this works from the surname, not the first name. And so you'll need to pop it in like this with a comma between. Now I won't come up because I'm not a consultant or registrar yet. However, normally people will pop up. A big thing to note is when you pop somebody in, their email address will come up in front of you. And it's really important that you check that the email address on Horus is the one that they want to receive it, and it's not an old one that they don't check anymore. Otherwise, they'll sit in that waiting box forever. And that's how you fill out the forms. And they look exactly the same for both the DOPs, apart from saying what procedure it is that you did. The bottom is exactly the same, as well as for the CBDs. So again, the CBDs are there so you discuss a patient or something that happened, whereas the mini-KEXs are you actively reviewing a patient and coming up with a management plan. So that's that side of things. And then finally, obviously, you've got your reflections, which you're going to fill out. And these are just open text boxes, effectively. If we then go back to portfolio, you can see there's a number of different bits here. So let's start at the beginning with overview. This will give you details of everything about you. It'll tell you your name, where you studied medicine, what placements you've done, who your educational and clinical supervisor is for that year, any reports that you've received, which obviously get filled up as towards the end of the year, your ARCP outcomes, if you've had any, as well as any temporary reviewers that have been given access to your portfolio and any declarations that you've made. So as soon as you join and when you log on for the first time, you'll find there's lots of things that you're forced to click through and agree to, like a probity declaration, a health declaration, as well as accepting the conditions of joining a foundation program. And so these all appear here just to say that you've done them. Next, if we go to the contents, this is a really important page and something that you don't often get told to go to. So here you can see every single thing that you've added to your portfolio. And what you need to do is map it to the curriculum. So if I click on this case-based discussion for a desaturation in the intensive care unit, you can see that it brings up the 4 sections of the foundation program. And if I click into them, all of the different sections that you need to evidence that you've achieved as a foundation doctor. And what you need to do is click onto them and map your case to what you think applies best. So for example, with this one, with the desaturation ITU and modes of ventilation, I've mapped it to communicating in a clear variety of settings, as well as recognises, assesses and initiates management of an acutely ill patient and is trained and manages cardiac and respiratory arrest. And these are obviously the things that I've touched on in the case-based discussion and what my feedback focuses on. And you have to do this for all of the different sections and hopefully have multiple evidence for different sections. If you're wondering what it means when something's got an exclamation mark next to it, this means that whoever you've sent it to hasn't signed it. And my advice would always be, don't map things that haven't been signed, because they'll show up in your summary, which we'll look at in a minute, but they won't count in your ARCP because a senior doctor hasn't verified them for you. So if we move on to the curriculum, this will now list all of the different foundation program competencies that we were just talking about. So you can see section 1, section 2, section 3, and section 4. And then with each of the different sections, what it will do is it will tell you everything that you've mapped against it. So you can click in and see to make sure that you've mapped something to each section. And if you're light on any areas, you can plan to go and find CBDs or mini KEXs to help fix that. By the end of the year, you need to have multiple evidence in every section, and then your educational supervisor will say that you've made satisfactory progress through the foundation program competencies, which gives evidence that you're in a place to proceed. Going back to the list then, there's a button here to download the portfolio should you require it, which we're not going to click today. And then you've got the subsections. So the first one here is a link back to your personal development plan, which was also in the form section. So if you want to go and look at your personal development plan, write it, say whether you've achieved it, then you can do. There's another way of getting to it. Same for your reflections. You can click here and it will take you into your reflections. So if you want to go back to a reflection and add more to it or say that you've achieved something, that's fine. A really important section is the tab. So tab is your team assessment of behaviour. And throughout your F1 and F2 year, you'll have to do one of these. And what you need to do is get a number of responses from different people on feedback of your performance. And this, you can see the mix here. So it has to be at least 2 consultants, at least 1 doctor more senior than F2, at least 2 nurses, and at least 2 allied healthcare professionals or other team members. So this can be physios, occupational therapists, as well as people even like the receptionist. You need a total of 10 responses. So you can see here 2, 4, 5, 6, 7. So you need to overfill some of these categories. And my advice would always be to send extremely more than you're looking for, because you'll find that people don't do it and the time that you get to do it is actually quite short. And so it's worth making sure you have enough, because if you don't meet the minimum amount, it won't count. Similarly, it's also worth bearing in mind that you'll only have to do this once, and once it's been done, your educational supervisor can release the results to you. The only time you'd have to repeat it is if you get any poor feedback. So that's the tab. The next section we're going to look at is there's a section on career planning. So if you have any careers meetings and want to start a careers form, that's a good way to go through that, and it kind of gives you a structure and a place to put it. And then there's a place you can link your e-learning for health account with your Horus portfolio. And what this means is any e-learning you do on e-learning for health will automatically track straight over to your Horus e-portfolio. And then finally, we've got any areas for listing any concerns, if anybody has any concerns, which hopefully will be none listed. And finally, the personal learning log. Now, although this is the last thing we're talking about, it's really important to focus on this. So you must record a minimum amount of hours teaching for each of your F1 and F2 years. And of those, a minimum of 30, so half of the 60 hours required, must be core teaching. And this is things like weekly teaching that the Foundation Academies put on for us and things like that. And interestingly, things like induction or life support courses do not count. And so every time you have teaching, you start a new form, you go through and basically list exactly what you did. So the title, the date, was it core or non-core? And then things like, was it a small group teaching, a grand round, a Schwartz group, or e-learning? and the number of hours it took. It's worth checking each year what the requirements are, because previously e-learning could only count for a small amount, but with the COVID pandemic, they've had to allow a lot more e-learning to count. It's always worth in the bottom writing a small reflection, especially if it's something that you've done online, to prove that you actually did the teaching. So just a summary of what it was and what you learned. And as I say, you need to keep this up to date, because the worst thing is getting towards ARCP and having to go through and try and remember and list 60 hours of teaching. It's also worth noting that in previous years, people may say that this was less. With COVID, they dropped this to 45, and in the previous year, it was much less again. So it's actually worth making sure that it is 60 for your year. And that is an overall summary of the Horus ePortfolio. It can seem quite daunting at the beginning, but actually once you go through and get used to where everything is, it's actually quite easy to navigate. And it's a good way of listing everything that you need to list and making sure everything's included. And by working through the different forms and the different certificates that you need to upload, everything is listed there for you. It's worth noting at the bottom here as well, there's a section called More Forms. And so actually there is a way of listing anything extra that you do that you might want to just put on to show that you've done it. For example, a publication, research, taster days, etc. However, these aren't essential that you cover. Thanks for listening. I hope you've enjoyed the video. If you've got any questions, please feel free to reach out on social media, and I hope you enjoy other 10-Minute Medicine videos.